The following segment is brought to you by Alabama Oral and Facial Surgery.
And welcome back to TOA. Are you, or maybe somebody that you know, still needing or thinking about getting those stubborn wisdom teeth removed? Well, if so, you can trust the best at Alabama Oral and Facial Surgery. We've got surgeon here, Dr. Henry McKay. Tell us a little bit more about this procedure and what it entails. So welcome to you first, sir.
Thank you. Good morning. Thanks for having me this morning.
I'm glad that you're here. So let me ask you this. When is an appropriate age? Let's start with that to get your wisdom teeth taken out.
Very good question. Generally, the best age is somewhere, before 18 or 19.
Yes.
The younger you are when you have the procedure, the less complications there are, the easier recovery. Just makes for a much easier time after surgery.
Let's talk about recovery. Is there a lot of bleeding, a lot of pain? What can we expect?
That's when you have wisdom teeth removed, most of the time at that age they are impacted, which means they are below the tissue. Mm-hmm. So a small opening in the gum line is performed, and you go and remove a little bone, section the teeth, remove them through a small incision. These incisions are closed with dissolvable sutures, and generally very little bleeding after the procedure.
Do most people have their wisdom teeth removed?
Most people, this day and age, more people do than years ago because of the way we take care of our teeth, because of the access to dentistry in our community. There are more people who have wisdom teeth that do not erupt, so therefore more people are having them removed.
I got you. I had mine taken out when I was 28. Which I remember thinking, oh my gosh, I'm too old to be having this done. But I lost, I think, 10 pounds because I really could only eat ice cream and popsicles for a few days.
That's right. Generally after the procedure, you'll stock up on soft foods like ice creams, pudding, mashed potatoes, and just try to stay away from carbonated drinks and crunchy, crumbly type foods just for a few days.
Are there any symptoms, so to speak? How would we know if, hey, this is going to be a problem or we need to have these removed?
Sure. A lot of times, one of the more problematic issues is when teeth partially erupt, when you have a partial impaction. And so when that is the case, you're more susceptible to getting food lodged down in the tooth. The teeth are somewhat susceptible to decay.
Okay.
And so therefore you can experience little small gum infections, which can be painful sometimes.
And how is the procedure itself, meaning how long does it last, and how many hours or days should we expect to be kind of out of commission?
Well, most procedures last anywhere from 30 minutes to an hour. They are performed under general anesthesia, so you are perfectly comfortable during the procedure. Your oral surgeon will do nerve blocks so that when you do wake up, you'll be completely comfortable.
That's nice. So it's nothing to be afraid of.
Absolutely not. Absolutely. Not this day and age.
That's right. How do we get more information, doctor, if we want to learn more or come see you?
Absolutely. Well, we have a website, alabamaoralsurgery.com, or you can call our office at 205-682-1099.
Okay, there's the information at the bottom of your screen, as well as the phone number, Alabama Oral and Facial Surgery. Dr. Henry McKay, we thank you for being here this morning. And if you've got any teeth, it doesn't have to just be wisdom, but any teeth issues at all, the doctor and his team can certainly help you. Thank you, sir.